Chronic pain, defined as daily pain lasting over 3 months, is the most common cause of long-term disability.
And according to the 2012 National Health Interview Survey, 25 million U.S. adults suffer from chronic pain. And within a 3-month period, at least as many report acute pain.
On this week's Health Talk, an expert in pain management will share common risk factors for developing chronic pain and what you can do to prevent it.
This important Health Talk is coming up next. Hello, my name is Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. Today on Health Talk, we're going to talk about key factors that lead to chronic pain.
Our guest today is Dr. Pooja Shah, an anesthesiologist with Norwalk Hospital. She's also an expert in pain management.
Welcome back.
Nice to be here.
Thank you for. So, start us off. Tell us a little bit about who's at risk for developing chronic pain.
So, chronic pain, as we've discussed prior, is pain that lasts over 3 months. That can develop from something as small as an acute injury, such as a broken bone, or it can be something that's a little harder to conceptualize, such as nerve damage, or coming from an accident years ago that you never thought would even last that long. The type of people that are susceptible to having more chronic pain tend to be patients that have a predisposition to utilize the mind part of the pain over the body part. And I'll explain this by saying that there's 2 different portions of pain. The body has receptors, such as when we touch a hot stove, that tell us to get away. And over time, these receptors can have blaring signs, such as a burn or a broken bone. But the mind has extremely a large amount of circuits that conceptualize pain, including serotonin receptors, dopamine receptors, and a lot of these are also linked to mental health conditions like depression and anxiety. And so the interplay between pain and mental health is utmost importance to understand for people to cope with pain over a long period of time.
Now, I think people often think of the mind and the body as separate beings almost, that if pain is in your head or it's in your body, but it's not in both. And in fact, pain can come from your body, but it's perceived in your head. I think one little exercise people can do at home is if you think about your right big toe, you can feel the sensations coming from your right big toe. If you're not thinking about that, you're not going to feel those sensations at all. That's almost the same game, but mechanism you can use to suppress pain is to somehow reorient your conscious process elsewhere. And I think we overlook that as doctors oftentimes.
Right. And we can't really go down the street and pick out who would be more susceptible to having chronic pain versus not. And we can't target and say that, if you're someone who has chronic pain, you're weaker than someone who doesn't. Because all of our bodies and minds do, have different transmissions and do take in input differently. However, it has been shown that, similar to what you said, that if we allow our minds to take over the pain to a greater degree than just focusing on ways to heal and cope with it, we will definitely suffer for a longer period of time.
So you're definitely not saying, though, that for all patients there's been no change in their bodies. What we're saying is that there's a complicated interplay between what happens with, say, chronic or repetitive injuries or even old injuries and with how people live with that.
Right. So some patients will have only one injury, that rear ending of a car when they were 15 and still continue to have issues from that 30 years later. And we may not be able to see it on their body or an MRI, but that doesn't mean that they don't feel it. On the other hand,
maybe that's another point, is just because you don't see the anatomic cause of pain, it doesn't mean you're crazy. If someone says they're having pain, they're having pain.
Right.
It's not made up. It's
and
not
2 people with the same injury at the same exact time to the same level, if we were to do that experiment, wouldn't come out with the same amount of pain, wouldn't have the same scale, nor would they both experience it for the same amount of time. Now, what makes the one person be able to deal and cope with it better? Some of it could be pure genetics, which we can't necessarily change, but the things that we can change are similar to what we've spoken about. Exercise, getting our minds off of the actual pain itself and using distraction mechanisms, whether that is actual meditation or mindfulness or going back to work, talking with an old friend, allowing ourselves to go back into more of a daily routine. Aside from that, it's also been shown that things like physical therapy, that the quicker you get back into exercise, if you're having a musculoskeletal pain, the quicker you will recover, and the less likely you will actually have more musculoskeletal issues down the line because your body and your posture is well equipped to handle the strains of normal life.
You touched on this before, but pain also can be very isolating, can't it? Chronic
Yes.
pain. And one way that sometimes people can feel better is by reaching out, making sure they continue to be engaged with their loved ones, with their communities, with other people who may be experiencing similar issues to get support.
Right. If people are not so lucky to have a good support system at home or within their community, there's also resources out there. Often we'll have people come in if they do suffer from a rare sort of pain or even a rare disease. We like to link them up with an internet support group, or there's even local ones in the community. And so there's always help at our fingertips if we do look far enough.
Knowing you're not alone can do a lot, I think.
That can do a tremendous amount.
Well, I know in terms of medications, antidepressants have been frequently used to treat chronic pain with some efficacy.
Right.
Does that mean that all those patients are depressed?
It doesn't mean that they're all depressed. So an example of a drug that the commercial is for Cymbalta is that depression hurts. And I tend to really like that commercial because it's very simply put. And it's more common for women than men to actually have somatic, which means body manifestations of their pain. So often women will get migraines, they may get abdominal pain, even muscle aches and pains in their upper shoulder area, and that's their way their body is dealing with stress, anxiety, life transitions. It's common for men as well, but it's just been proven to be more common in women. And often they say that people who suffer from chronic depression may not even have the typical signs that you think of, moping around, lack of sleep or appetite. It really might just be the pain itself. Now, has it been shown that all of these people suffering from this pain are depressed? Not necessarily, but if the depression is untreated, people with chronic pain will surely suffer more. And so the underlying link between mind and body always comes back, and it is very important. One of our first screenings in our chronic pain office is a screening for depression or anxiety, because to have that pointed out and have that simultaneously looked at by a psychiatrist or psychologist is equally as important as what their body is feeling.
Now, some people would argue, though, that chronic pain causes depression because chronically being in pain is depressing.
I can totally understand that, yes.
And I would think that even
Does
if
it
you
matter?
don't know where the cycle started, it's a cycle that's important to deal with.
Yeah, I think that's really
right.
the
It's
issue.
like
It doesn't
they say,
really matter.
the chicken or the egg, right? Were you depressed to begin with, and that's why you tended to have a predisposition towards chronic pain? Or were you as jubilant as could be, and now you're brought down by this terrible pain? Whatever came first, if you're in a situation where you're feeling depressed with this chronic pain burden, it will be important to face both the actual physical aspect of it, medications, physical therapy, any sort of interventions, and also the psychological part. And the best part would be if all of that team can work together. And we like to try to think that we do a good job with that.
And really what we're talking about is holistic care for the whole person and not isolating them into a specific painful body part, but to say you're a whole person and you're very complex, and all of these things may help you feel better, and feeling better is the goal.
Sometimes a 5-minute breathing exercise can get your mind off of the pain and also increase the oxygen that's taken in, the blood flow, and a headache can be gone. And if that's gone, the rest of your day could be better, and maybe another pain symptom that you might have felt may not be as glaring in your head. So it all starts with basic things like that.
One question I have is, of the chronic pain patients, the few that I have seen and know, many of them are very resistant to the idea that there are emotional contributions to their, or psychiatric, and maybe that's psychological contributions to their pain. Why is that? How do you get past that sort of resistance? It's almost that people, they want the medical explanation.
Yes.
Because without that, I don't know. Explain to me why, in your experience, people always want that, don't always, but gravitate towards that medical anatomic explanation.
Well, I think it's easier for people to understand something that they can actually see. And it's easier to say, well, this disc is not in place, this bone is not in the right place, so that is why I feel pain. But if I have a whole body scan that doesn't look, particularly wrong, and all of my physical exam is fine, then why am I feeling this pain? Then you start feeling like, is there something that I'm not seeing or that the doctor's not seeing? And that's very difficult for the human mind to actually take that in. And it's like anything in life, when there's not an answer, it's hard for us to sit with it. It's hard to sit with uncertainty, and it's hard to sit with the ambiguity of
And
such a thing.
I think it's hard for people also to believe that their brain can be giving them whatever physical symptoms.
Signals, yeah.
But brains do other things. So we were talking earlier about blushing. Maybe you want to tell that story.
Well, and just wanted to mention too, I think that culturally as a society in America, and even to some extent physicians, we don't treat psychologic issues in the same way that we treat or consider
That's true. We consider it
physical
weakness.
issues.
We consider it
So-
that they're absolutely right.
So we need to do a better job to say people are
Yes.
whole people, and psychiatric issues are just as real,
Yeah.
just as important,
Right.
and just as
And
contributory.
not to be judgmental about that.
Exactly.
We're
And
getting
over
better
the-
about that.
And
but
over the last 5 years, I think there's been a huge interplay about Mental Health Awareness Month and walks, but I can't say that was the case 10, 15, 20 years ago. And so now that this newer generation of doctors like myself are coming into understanding that that is equal, if not even more important, because everything does start with the brain, hopefully down the line we can kind of tack that on first and foremost, and then look at the body as a whole.
We have about 90 seconds, but the example you mentioned is I often tell patients that if I get embarrassed or have an emotion, I blush. I tend to blush easily, and both of those are real. The emotion of embarrassment is really real, and the blushing is really real.
and it's a physical manifestation of an emotion.
Of purely an emotion.
And that's such a perfect, simple example. And so if our bodies are doing that, even in a more complex way with pain every day. And so that's a really good point to keep in mind.
So you shouldn't be embarrassed by chronic pain,
No.
and you shouldn't be embarrassed by the suggestion that psychological intervention may be palliative.
Should be open to the fact that our minds and bodies have to be treated simultaneously for our whole self to be healed and for better wellness.
That's a wonderful message to end on.
Absolutely.
And an important one, I think, for all of us to learn. Patients and physicians, people at home, willing to accept that we are sentient human beings and that our consciousness is how we perceive everything, including those physical signals from our body. And if we could alter that,
Thank you
it's
so
really,
much.
really interesting. Bringing Eastern and Western medicine together.
Yeah.
Thank you. Unfortunately, we need to wrap this up, and that really is unfortunately. Thank you, Pooja, for joining us today on Health Talk.
Viewers, please do email us your questions and comments to healthtalk@wchn.org. We would love to hear from you.
And thanks for watching, and think happy thoughts.
Stay well.